Roe v. Wade was a court ruling by the U.S. Supreme Court that legalized abortion in the U.S. Prior to this, however, abortion had been illegal for many years. Although abortion remains legal in Texas today, there have been many restrictions implemented since then. Abortion restrictions in Texas include the following. Abortion is prohibited after 20 weeks of gestation. The patient is required to have an ultrasound to which they must watch and listen to before getting the procedure. Minors may not get an abortion without parental consent. Abortion is only covered by insurance companies in cases of life endangerment or compromise of physical health. There are very few clinics in the state of Texas that still perform abortions. Despite abortion still being legal in Texas, the restrictions have made it almost impossible for women in Texas to receive an abortion, which a woman should be able to choose without having to worry about so many obstacles implemented by the restrictions. Not only that, but there are also some negative effects that could come from these restrictions, as many women may turn to unsafe abortions that could result in fatal complications. Senator Kirsten Gillibrand had a roundtable discussion with medical professionals, activists, and lawmakers to discuss abortion restrictions.
I think this is truly a life or death issue. You heard from doctors today about patients who lost their lives when abortion services weren't available and weren't readily available. You also heard from providers that if you're a Black woman in America today, your maternal mortality rate is so much higher than white women because of institutional racism. You heard from providers that if these laws pass, if you're white and privileged, you'll be able to get access because you have the means. But if you're poor and a person of color, likely you won't. And that's wrong. It's morally wrong. And we're dividing this country further and further.
The restrictions may not make abortion illegal, but they still prevent countless women from obtaining one, and the more we let them advance, the closer we get to losing the right to choose whether we want an abortion or not, which is why we must act now. There are many ways in which we can support a woman's right to get an abortion, such as attending pro-choice rallies, protesting against abortion laws, voting for pro-choice candidates, and supporting reproductive rights and abortion advocacy organizations such as Planned Parenthood. Together, we can achieve accessible abortions for everyone. At the end of the day, a woman should have the right to choose when to become a parent. The ability to do so would result in a reduced number of unsafe abortions and even help reduce the amount of children overpopulating adoption homes with inadequate care. With the help of others who wish to make a difference in women's rights, we can achieve our goal and make abortion accessible to everyone.